Welcome to our Living Donor Education class. Please write down any questions you may have, and we will be happy to answer them at the end of the session. The goal of this educational class is to help you understand all aspects of the liver donation process so that you may make an informed decision about pursuing liver donation. At the end of this session, if you decide to be evaluated as a donor, we will ask you to sign a living donor informed consent process before beginning your evaluation. In this class, we will discuss the following: liver transplantation and alternatives for patients with end-stage liver failure, who can be a liver donor, the living donor team, the medical and psychosocial evaluation process, the surgical procedure and post-operative care, potential medical, psychosocial, and financial risks, our center's experience with living donation, and your rights and responsibilities. The number of organs available from deceased donors is significantly less than the number of people who are in need of a liver transplant. This unfortunately means that approximately 30% of patients, nearly 1 in 3, die every year waiting for a transplant. This is the benefit of living donation. Once a donor has been identified and approved, we can move forward with the living donor liver transplant. This increases your recipient's chance of survival because they are able to have the surgery sooner and while they are in better overall health. Livers for transplant come from two sources: deceased donors, which are donors that are declared brain dead or have been declared dead after their heart has stopped, and living donors, which are people who have volunteered to donate a part of their liver. In addition to living donor transplantation, patients have the alternative of remaining on the wait list for a deceased donor liver to become available. A deceased donor liver may become available for the recipient before the donor evaluation is completed or the living donor transplant occurs. Transplant hospitals determine candidacy for transplantation based on the existing hospital-specific guidelines or practices and clinical judgment. Recipient risk factors. Any transplant candidate can have an increased likelihood of adverse outcomes that exceed local or national averages, do not necessarily prohibit transplantation, and are not disclosed to the donor. The recovery hospital can disclose to the living donor certain information about candidates only with their permission, including the reason for a transplant candidate's increased likelihood of adverse outcomes, and personal health information, which is confidential and protected under privacy law. Benefits of living donation for the recipient. They don't have to wait for a deceased donor liver to become available. Living donation can decrease a patient's risk of dying while waiting for a deceased donor transplant by 30 to 40%. Patients are less sick by the time they receive a liver transplant, a quicker recovery from the transplant surgery, and it's an elective, non-emergent surgery which can be planned in advance. Benefits for the donor. The donor does not benefit medically from the donation. The donor benefits emotionally by being able to help someone they care about have a better quality of life and live longer. This is an overview of the living liver donation process from start to finish. You are currently in the phase Living Liver Donor Candidacy Evaluation. Who can be a living liver donor? You will start the process by filling out a living donor questionnaire. This is the first step to determine your living donor candidacy. Then, you will have your blood type checked to make sure it's compatible with your intended recipient. If your blood type is compatible, you will be scheduled for the full living donor evaluation, which will include the following appointments and tests: living donor coordinator, living donor hepatologist, living donor surgeon, living donor social worker. As part of the evaluation, you will either meet with or have your chart reviewed by a transplant dietitian, transplant pharmacist, independent living donor advocate, and either a psychologist or psychiatrist. Your testing would also include lab work, an electrocardiogram or EKG, a CT of the abdomen, an MRI of the abdomen, a chest X-ray or CT chest, FibroScan, possibly additional heart testing, and any additional tests based on the individual donor. Donor evaluation process. This starts from when the donor is identified as a potential living donor and continues until donation occurs, or the donor is no longer a candidate. The donor will receive a medical and psychosocial evaluation, education throughout the donation process. UT Southwestern will take all reasonable precautions to provide confidentiality for the donor and recipient. Donor information will not be shared with recipient. They can opt out at any point in the process and do so in a way that is protected and confidential with assistance from an independent living donor advocate. The donor must commit to post-operative follow-up testing, which would be a clinic appointment and lab work at 7 to 14 days, 6 months, 1 year, and 2 years after donation. There are minimal inherent risks associated with being evaluated for donation that include allergic reactions to contrast for testing, discovery of reportable infections, discovery of serious medical conditions, discovery of adverse genetic findings unknown to the living donor, discovery of certain abnormalities that will require more testing at the living donor's expense or create the need for unexpected decisions on the part of the transplant team. Health information obtained during the living donor evaluation will be subject to the same regulations as all medical records, and could reveal conditions that the transplant center must report to local, state, or federal public health authorities. UT Southwestern is required to report living donor follow-up information according to UNOS policy at 6 months, 1 year, and 2 years after donation, and have the donor commit to post-operative follow-up testing coordinated by the recovery hospital. Any infectious disease or malignancy that is pertinent to acute recipient care discovered during the donor's first 2 years of follow-up care. These may need to be reported to local, state, or federal public health authorities, will be disclosed to the recipient's transplant hospital, and will be reported to UNOS. Liver Donor Selection Committee. Once all testing and appointments are completed and have resulted, the donor's evaluation will be discussed at our multidisciplinary meeting to determine their candidacy as a living liver donor. The donor candidacy outcome can be denied, meaning not a candidate, deferred, meaning a possible candidate that will require further testing and appointments before a decision can be made, and approved. The donor will be sent a letter with the team's decision. If approved, a date for living donor transplant surgery will be set. About 1 to 2 weeks prior to surgery, you will have the below preoperative appointments and testing. Donors are admitted to the hospital the morning of the surgery. Donors should not eat or drink after midnight the night before the surgery. Surgery usually takes approximately 6 hours. After surgery, you would go to the intensive care unit for overnight monitoring and then transferred to the transplant floor. You will have a catheter in your bladder, an intravenous catheter, better known as IV, possible drainage tubes, a dressing to your abdomen, and would receive pain medications. The hospital stay is typically between 5 to 7 days. After hospital discharge, you will need to stay locally in the Dallas-Fort Worth area for about 4 weeks after donation. You will not be able to drive for about 3 weeks. You may be taking pain medications. You will have a dressing and may have a drain. You will be away from work for about 6 to 8 weeks. You will not be able to lift anything heavier than 10 pounds for about 4 to 6 weeks. You will need to follow up with our transplant clinic at 1 week after discharge from the hospital, 6 months after donation, 1 year after donation, and 2 years after donation. The recipient surgery. Their surgery usually takes around 6 to 8 hours. Recipients go to the intensive care unit after surgery and then to the transplant floor. Their hospital stay is typically between 5 to 10 days. The recipient will have to take medications for life to prevent rejection of the donated liver. We have listed the potential medical and surgical risks below. You will have an appointment with your surgeon who will go over them with you in more detail. Following psychosocial risks are associated with living donation: problems with body image, post-surgery depression or anxiety, and feelings of emotional distress or grief if the transplant recipient experiences an unexpected outcome. There are potential financial impacts associated with living donation. Below are a few of the potential risks. You will have an appointment with our social worker and transplant team who will go over them with you in more detail. We have placed information below about the scientific registry of transplant recipients. We will provide you with the most up-to-date 1-year and 3-year survival data during your appointment. Your rights include protected healthcare information, confidentiality for both donor and recipient. Communication between the donor and the transplant center will remain confidential. An independent living donor advocate will be provided to you. You may opt out at any time, and this is protected and confidential. UT Southwestern is a Medicare-approved transplant center. If UT Southwestern was to lose Medicare approval, it could affect the payment of the recipient's immunosuppressive medications after transplant. If you are rejected as a donor at our program, you will be informed that you may be evaluated at another transplant program that may have different selection criteria. Your responsibilities as a donor: to provide healthcare information, to know that it is a federal crime for any person to knowingly acquire, obtain, or transfer any human organ for valuable consideration, anything of value such as cash, property, and vacations. And you will be contacted by the living donor transplant coordinator and team for follow-up at 10 to 14 days after donation, 6 months after donation, 1 year after donation, and 2 years after donation. We have placed resources below regarding living liver donation. This concludes our Living Liver Donor Education session. We will discuss your questions during your education appointment or follow-up call. Thank you for your time, and we wish you the best.